where we reflect on issues that really matter. In today's episode, we will focus on something that we take for granted until it's too late, our eyes. We are joined by a very special guest, Dr. Vitthal Satav, a renowned ophthalmologist from Akash Eye Clinic and Laser Center. Dr. Satav will take us through the complex yet fascinating realm of eye health and vision care. Welcome to the show, Dr. Satav. It's a pleasure to have you with us.
Thank you. Thank you very much, Prince.
So, I'm your host, Prince Chaudhary. Let's dive right in. So, talking about eyes and eye care, something that we really ignore. So, my first question to you would be what are the key signs that indicate healthy eyes?
See, as all of us know, eye is working like as a camera.
Correct.
Camera has a lens. Then the structure of camera is like having lens and roll. So, the key signs of having healthy eyes that having a good vision.
Good vision.
Yes.
Something which is called a 20/20 vision.
Yes, 20/20 vision, 6/6 vision.
6/6 vision.
Is a sign of healthy eye.
Okay.
Then having shiny eyes.
Shiny
like
eyes.
White, clear eyes white.
Oh.
There is no redness.
Oh.
So it indicates there is no dryness.
There's no dryness.
And again, the alignment of the eye.
Alignment.
So if alignment is proper, there is no squinting. These are actually good signs of healthy eyes.
Healthy eyes. Now, coming to a very, very critical thing where eyes are concerned, cataracts. So, how does cataracts develop and what steps can be taken to prevent it?
Yes. Again, I am telling you, the eye, the structure of eye is like camera. In camera, we have lens. The same way, we have a crystalline lens, very clear lens inside, fitted inside our eye.
Oh.
And it is made up of proteins.
Oh, it's made up of proteins.
Yes. And if with age or if some insult happens to that protein, proteins become opaque.
Oh, it
And
becomes
that
opaque.
leads to cloudiness in the clear lens, and we call it cataract.
So does like a film come in? Does it prevent like for the vision to be clear? I mean, I was talking to some people earlier. They told me like a film comes in. Is it possible for that to have developed?
Not like film is coming in front of the eye or inside the eye. The natural lens becomes cloudy.
The natural lens becomes clear.
Yes. It's like it becomes cloudy. We call it cataract.
So what are the steps that one can take to prevent it? And is a surgery necessary?
See, cataract is actually senile process. With age, it develops.
With age.
But of course, in some patients or with people who are having diabetes, some health issues, it develops little early.
Oh, it develops early.
And people who are having some medicines like steroids,
Steroids.
steroids tablets.
Okay.
Those people develops this cataract little early.
Little early.
So, I think we should have a healthy lifestyle.
Healthy lifestyle.
So that this diabetes, hypertension, other health issues, we should take care.
So
That cataract development is delayed.
Delayed.
And if you are on this drops or steroid, that should be taken under clinicians' guidance.
Absolutely. So earlier, I believe, like a surgery used to take place. Now, I believe they have lasers which take care of that.
Yes. See, cataract, there is no medicine.
There is no
No
medicine.
medicine. In initial stage, some drops will help, like
Okay.
lubricant drops. Or in initial stage, some glasses will help.
Some glasses.
Some minus glasses will help to improve the vision little bit. But in advanced stage, the surgery is only the way.
Surgery is the only way.
Only way.
Taking eye drops also will help.
In some because we have tear film in front of the eye,
Right.
which we put some lubricant drops,
Okay.
so that will add quality to that tear film.
Okay.
Little bit it will improve in initial stage of cataract.
Okay.
And glasses.
Okay.
But in advanced stage, we need to do we have to
Surgery.
remove it with surgery.
You have to.
And previously, we used to remove whole lens in toto,
Correct.
and lens was not there. Artificial lens was not there.
Artificial lens was not.
So you might be seeing soda water bottle glasses.
Correct.
In, old type of surgeries.
Correct.
You might have seen in Babubai in that Hera Fairy film.
Yes.
It
Correct.
was with, it was with dark,
Yes.
thick glasses.
Absolutely.
So those were called acrylic glasses.
Oh,
So it was very troublesome for patients to
very
manage.
troublesome. I know.
So then intraocular lenses got introduced, and we started putting intraocular lenses, and then people started getting rid of glasses after this surgery. Nowadays, cataract surgery is not only surgery; it is refractive surgery.
Refractive surgery.
Yes, it is done for getting rid of glasses as well, and nowadays it is done by laser,
Oh,
femto laser.
Okay.
We call it femto laser assisted cataract surgery. So the advantage is we get rid of glasses also, and recovery is very fast.
Oh, the recovery
The
is very
next
fast.
day, the person can join his regular activities.
So, doc, people wear glasses. Like I'm wearing glasses, you're wearing glasses. So when if you remove these glasses, people also put that I don't know you know they put that like a small glass type of a thing on the eye. Um, what's it called? Like like
Contact lens.
contact lens.
Yes.
So how good is contact lens as compared to glasses?
See, the contact lens is option to the glasses. If
Is it as effective?
yes, it is as effective as spectacle.
Okay.
See, spectacle. If somebody is not doesn't want spectacle due to the cosmetic reason,
Right.
then he can go for contact lens.
Contact lens.
Contact lens we have to put in the eye in the
Right.
morning, and we have to remove
In the night.
We cannot
Keep it
keep
overnight.
it overnight. That is the main drawback of the contact
Yeah.
lens. That's why refractive lasers were introduced.
Oh,
So this cornea, transparent part, with the help of laser,
right.
we reshape the cornea. And
Reshape
then
the cornea.
Reshape the cornea, and there is no need of glasses or no need of contact lens.
My God.
The person can roam without glasses, without contact lens.
So now something which is a very, very serious, how should I say, ailment or a problem with eyes is glaucoma. Where people become blind. So just tell our viewers what exactly is glaucoma. Is it curable? How does it happen?
Yes, glaucoma is a very very terrific disease as eye is concerned, because glaucoma is a disease of optic nerve.
Optic nerve.
There is a gradual loss of nerve fibers which are present in the optic nerve. The optic nerve is a nerve which connects eye to the brain, which carries signals from eye to the brain. And if that nerve is damaged or nerve is deteriorated, the vision is lost. And the main problem is glaucoma is there is no symptoms.
There are no
No
symptoms.
symptoms. No symptoms. Yeah, and other problem is there is gradual loss of these nerve fibers, and that is not reversible. As
That
nerve
is not
damage is
reversible.
not reversible. These two major problems with glaucoma.
But suppose someone has got glaucoma and is progressive, as you say, will they kind of slowly start losing sight, how else will they know? They will not know at all.
That is the problem. We call it silent thief of vision. You know, thief will take away your money and will not know.
Will not know.
So glaucoma is a silent thief of vision. In initial stage, patient will not come to know.
It's like high BP. Some people have high BP,
But there are no
but there are no
symptoms.
symptoms.
It's like diabetes also.
It's like diabetes.
In diabetes, in early stage, there are no symptoms.
There are no symptoms. This is quite alarming. And
But in diabetes, treatment is there. We can reverse some changes. But here, when nerve fibers we lose, those are not reversible.
they are not reversible.
The vision, the patient loses vision from periphery to the center.
Periphery to the center.
They will start losing vision from periphery. Then they will lose central vision at the end of the process.
So why does glaucoma happen? Is there any series of reasons or causes that
The first cause is actually glaucoma is genetic causes. There.
genetic?
If we found in one family, their siblings or their children, there are great chances of having glaucoma. So if the person is with glaucoma, to all people in family, like siblings or children, we should screen them for glaucoma.
Should
as,
screen them.
as there is no symptom, we have to screen. We have to, some certain scans are done, some tests are done to diagnose glaucoma in early stage. And that is the key. If we diagnose in early stage, we can protect or we can maintain the vision, remaining vision.
You can
100%.
maintain it.
Yes, definitely. That is a good part.
Yeah, the good part.
But as
okay.
you ask, other reasons are there. So, like if the patients are or person are putting steroid drops on their own,
Steroid drops on their
steroid
own.
drops, or they are having tablets, steroid tablets for longer days. Then that
So people who do exercise and all, they take a lot of steroids. Can that affect the eyes?
yes,
They can.
definitely. It can cause cataract. It can cause glaucoma also.
So it can cause cataract. Steroids can.
Yes. So regular screening is required, and never take this medicine without doctor's consultation.
Doctor's consultation. Okay. Early warning signs of eye diseases. What should people watch out for?
See,
How many types of eye diseases? Are
see, the most common disease, as I said, cataract.
there? Cataract.
In cataract, the early things are getting everything hazy. These are early symptoms we can say.
Correct.
And when we check and go to the eye hospital, then they will detect the stage of the cataract. But in cataract, there is no emergency because there are certain stages, and we can wait till your vision is hampered. Then other is refractive errors,
Refractive.
like myopia, hypermetropia.
Myopia is short-sightedness.
Yes, myopia. The patient can see near things, but
Cannot
distant
see
things
far.
cannot see. And presbyopia. Presbyopia is very common. Difficulty while reading when the age is above 40.
Oh.
So we have natural lens which have accommodative power. So,
Accommodative power.
yes, before 40, that lens accommodates, so we can see distant and near as well
Oh.
with same power. So after 40, that accommodation power will loses. The natural lens loses that accommodation power. So people require glasses for reading.
So, some people are telling me two things. One is when this, as they age, or if they've been, on the screen for too long, for many days, they see a worm-like, like a circular thing in front of their eyes. One is that, and one is flashes. So why do these things occur? Is it the eyes are very strained?
Yes, these worm-like things we call floaters.
Floaters, exactly.
Yes.
Floaters.
So we have actually jelly-like fluid inside the eye, so which is thick in nature in young age, but with age that liquefies, and there are some particles which moves inside the eye. So their shadow falls on the retina, and with the person or we see something is moving in front of the eye. This is called floaters, and this is with age.
Is it serious? Very serious?
No. It is not serious. And second thing, some flashes of light.
Yeah.
Yes, flashes of light is serious things because it indicates there is pull on the retina.
There is what on the
Pull. There is something is pull from vitreous side on the retina.
Yeah.
So regular retina examination, we put some dilating drops and we see whole retina. That is required.
Okay, so how frequently should one schedule eye examinations?
See, eye examination, if person is healthy, his eyes are normal, then once in a year eye examination is sufficient. But if the person is having glaucoma or diabetes, then depending on the stage,
Okay.
we should schedule the eye examination. I am having one patient who is very rich, but he is having diabetes, and his children are telling him, his wife is telling him, don't eat sugar, control sugar. Now he's having grade 4 diabetic retinopathy, and vision is not there.
Vision is not there.
Vision is not there. So he was just avoiding eye checkups. He was just avoiding sugar control. Now he has lot of money, but vision is not there. So my recommendation is, if you are having diabetes, control your sugar at any cost. Sugar should be under control, and eye examination, regular eye examinations are very necessary because in early stage we have some lasers,
Right.
we have some injections that can prevent the visual loss in future, and we can save their vision.
So, LASIK, LASIK, how can doctors determine that, or other vision correction procedures which are suitable for a patient?
Yes, LASIK is very commonly done refractive procedure.
Refractive.
Yes, it is the procedure which is done on the transparent part of the eye. We call it cornea.
Cornea.
So cornea has certain power. With the help of laser, we change the shape of this transparent part, cornea, and there is no need of glasses. Yes. And it is done in 10 minutes for both eyes.
My God.
It's fantastic technology,
Right.
and people are glasses free. See, I had a patient
Mhm.
who was going for interview and for selection of air hostess.
My God.
Her dreams were so high, but the spectacle was the hindrance. So she got underwent this procedure. Now she is selected as a air hostess.
She selected that hostel.
So
That's
this
amazing.
is a life-changing procedure,
Wow.
especially young people, and young people. India, the young people are very important. They are
Absolutely.
backbone of our country.
Absolutely.
So this amazing technology, they are changing lives of people.
Wow. Wow.
And nowadays, as I have said, this femto laser assisted cataract surgery. After cataract surgery, also people are getting rid of glasses.
They're
This is
getting rid of
great
glasses.
advantage.
Correct, because the lens comes in.
Lenses, these are premium lenses.
Premium lens.
Bifocal lenses, trifocal lenses. We have those options, and when we put those lenses, people are glasses free. They are reading distant, and they are seeing mobile, newspaper, reading newspaper without glasses.
Without glasses.
They are very happy
Wow,
nowadays.
fantastic. Common eye conditions and their typical symptoms. I think have we covered that? We kind of cataract now. That okay. Recent innovations and breakthroughs. You spoke about laser have been made in eye care and treatment. Could you explain? Okay, what exactly is it? Just the laser, or are there some other innovation which are?
Yes, recent innovation like femto lasers, they have changed the scenario. It's like nowadays electric vehicles are introduced.
Correct.
It has changed the world of vehicle.
Right.
Same way, femto laser, when they have introduced, they have changed the scenario. Exactly, I have told now. In lasers, previously we used to mechanical blades, blade LASIKs were there. Now everything is bladeless, flapless. So without blades, we are doing everything. Cataract, we were using blades. We used to use with manual systems, but now everything is done by lasers, and it is giving so much accuracy. Accuracy is there,
That's
and
important.
results are recovery is very fast.
Recovery. There.
Chances of infections are becoming less and less. Recovery is fast.
Exactly.
People are joining their routine activities very next day.
My God, it's fabulous.
And that has changed the whole scenario.
So eye test, standard eye test. How can one interpret the results of a standard eye test?
Yes, a lot of people ask this question because this vision, usually we write vision as 6'6", 20 by 20.
20 by 20.
So this is writing down the capacity of the person, how much he is seeing.
Right.
So meaning of 6 by 6 is 6 by 6 is 6 meter by 6 meter.
6 meter by 6.
The patient is sitting at the distance of 6 meter from the chart,
Right.
and it is compared with the normal person.
Oh.
Normal person.
Achha.
So if it is written 6 by 6, that is normal. If it is 6 by 60, that means vision is impaired. He is seeing from 6 meter, that normal person is able to see from 60 meters.
My God.
Few persons are having supervision, 6 by 5.
6 by 5.
It is super than normal person.
And how common is 6 by 5?
Yes, very not that common, but few patients we find.
Okay.
We have some technology in lasers,
Okay.
which makes vision super fine. 6 by 5, 6 by 4 also.
6 by 4?
Yes,
Amazing.
we finding in some individuals.
Wow. What about 20/20 vision?
20/20, it is same as 6 meter they have converted into feet.
Acha, into feet.
Yes, 6 meter, 6 by 6 is same as 20 by 20.
20 by.
6 by 6 is in meters, 20 by 20 is in feet.
Because I think a meter is 3 feet, so it almost works out of the
It is
same.
20 feet.
Okay.
And other is when you see the prescription of the glasses, there is minus sphere, then plus sphere. Minus sphere is usually prescribed for myopia.
Myopia.
Plus is prescribed for hypermetropia.
Right.
Then plus addition is prescribed for presbyopia, the glasses for reading.
Glasses.
This is other actually which we see in spectacle prescription.
Absolutely.
And tonometry, one more point. Tonometry is intraocular pressure. Usually we have pressure inside the eye that should be in between 10 to 21 millimeter of mercury. That is normal pressure.
So like blood pressure goes up, eye pressure also goes up and down, or
There is no direct relation,
there's no
but
direct.
in long-standing cases, it may happen. There is no direct relation.
There's no direct relation.
Yes.
But
normal-
eye pressure is there.
eye pressure is there, and that is very important. If it is on higher side for longer time, that will lead to glaucoma.
That will lead to glaucoma also.
That will damage the optic nerve fibers. See, other structure of the eyes are tough. What is delicate? The optic nerve fibers are very delicate.
Very delicate.
If the pressure will rise above normal level and it is there for longer period, that will definitely going to damage optic nerve fiber.
So blood pressure, whether it's in your heart, it's in your eyes.
Yes.
If it's high, it's going to cause problem.
Yes.
What if it goes down very low?
So usually it doesn't go down below
Achha.
10.
Achha.
It is between 10 to 21.
10.
Some other specific condition it may go down if the patient is under treatment.
Okay. So children, at what age can they have a comprehensive eye examination done?
Yes, it is very people are very confused about this, and in family, child is very precious.
Absolutely.
This is the we can say heart of the family.
Heart of the family. Absolutely.
So as far as children are concerned, first comprehensive eye examination I advise at 6 months of age.
6 months.
6 months of age.
So you can determine if the eye is healthy or not.
Yes, eye is healthy means whether eyes are aligned properly,
Aligned.
where eyes are focusing properly. So pediatric ophthalmologist will see at the age of 6 months these things. The next eye examination I would suggest around the age of 3 years.
3 years.
Yes. Again
6 months, 3 years.
3 years, and after that around 6 years
6
before
years.
child goes to the school. 5 year or 6 year
5 or
before
6
going
years.
to school. So during this pair, we usually screen for amblyopia, lazy eye.
Lazy eye.
Refractive error.
What is lazy eye?
See, some children are having high number only in one eye, and that may lead to the underutilization of that eye.
Okay.
So that is very important to find out in that stage, because if we treat in that particular age, results are very good.
Results are good.
I have come across with the children who are unaware of this till the age of 16 years, 17 years, because they were not screened at the school admission or before that. And it is very difficult to treat at the age of 16, because already eye, brain, coordination,
Everything has come into
developed.
place. That is
So it is very difficult.
It's probably like cancer. After it reaches the third stage, is incurable.
Right.
So early detection is very important.
Yes, because the brain and eye development happens maximum in this going stage.
Going period.
And if we detect in that stage, and if we treat in that stage, then only there will be the
Possibility of
increasing the vision.
So if someone sustains an eye injury, what are the immediate steps that they can take?
Yes.
It depends on the injury, of
Yes,
course.
yes, because it is accident.
Yes.
It happens.
All of a
It
sudden.
can happen to anybody.
Can happen.
So this is very important question. So if something happens to the eye, let's say injury, scratch, so my suggestion is don't press or don't rub the eye.
Do not rub the eye.
Do not rub the eye. And if there is trauma is with some chemical,
Right.
like some acid or
Okay.
alkali,
Right.
then they have to wash with copious water, plenty of water.
Oh,
Let's say for 20 minutes, the person should wash the eye with water, clean water.
okay. Clean water. Splash the eye.
Splashes, yes. Because in that period, if that chemical get washed, it is very useful.
Oh,
Especially alkali. Alkali burn is very dangerous.
oh.
It is dangerous than acid burn, because alkali goes on penetrating.
Okay.
So-
And what is alkali actually?
Alkali, the common alkali burn is chuna.
Chuna.
That people use in tobacco.
Correct.
They have that
The white
pudi,
color- the
white
pudi,
color
yeah.
pudi, and that is semi-solid. And,
Correct.
And a lot of people, patients come from rural area, children especially, and they press that pudi,
Thing.
and that
And the
splashes
same-
into the eye.
It just splashes into the eye.
And whole cornea goes, whole eye is get traumatized.
My
And if it is not treated in time,
Immediately.
yes, the child becomes blind.
Child becomes blind.
So immediately they have to wash with
Splash
plain
water.
Yes, at least for 20 minutes.
20
And immediately they should go to the eye hospital. because that is very dangerous. And through this podcast, I would like to uh, uh, tell those people who are eating this tobacco with tuna, they should take proper care, because lot of children are becoming blind due to that bad habit of this.
Children are becoming blind. Yes. So, doc, tell me one thing. When you get up in the morning and we wash our face, many of us have got a habit of splashing, open our eyes and splashing water into it. So, I've been told by a lot of people that do not splash water into your eyes. It can damage your eyes. Is this true?
See, once in a day it is okay.
Once in
In
a
the
day.
morning,
In the morning.
because lot of discharge is there
Correct.
in the morning. In the morning, once in a day it is okay, but frequently putting water or
Frequently.
I don't actually recommend, because we have natural tear films
We are.
and we have proper concentration of this component.
Okay.
So if we splash the water, that normal tears or natural tears
Get
get
diluted.
disturbed.
Or
Get disturbed.
Get disturbed.
Uh,
Okay.
so I don't recommend frequent
Okay.
washing.
Once in the morning is okay.
To remove the actually
The
discharge
discharge
and all those things.
The night when you sleep. And
Yes,
all that. There's a white discharge sometimes.
Yes. For that we can clean, but 4 times, 5 times, not
It's
required.
not required. Now, there's another thing which happens to a lot of people, and many people don't know the actual word for it. They said, "मुझे आँख हो गया, मुझे आँख आया." It's conjunctivitis. So your eyes turn red, they swell up. Why does that happen, and is it dangerous?
Yes, it is actually viral conjunctivitis you are talking about. It is actually contagious.
It is contagious. That I know.
Yes.
Yes.
It actually spreads from one person to another.
Without touching also.
Without not it doesn't spread without touch.
Acha, without with
Yes.
touching.
Some contact has to be
Some
there.
contact.
If I
It's
I'm
not
having-
airborne.
If I am having conjunctivitis, I will rub my eye, my hand.
And then
If
you
I
might
touch somewhere,
and then you might
and
touch
if you
it.
touch there, and then again you will rub your eyes.
Okay, so it'll go.
That way, that spreads.
That thing.
So this is contagious. Usually, it happens in early seasons of rain, when rain will
Rain
start.
comes. Okay. Monsoons.
Monsoons. So it depends. Nowadays, it is very sporadic, unpredictable. Any
Correct.
season it starts.
I know it's been raining in November also.
Mm.
Retinal detachment. How can one identify the warning signs of a possible retinal detachment?
Retinal detachments. As in the beginning only, I told you that we have retina.
Right.
It works like a roll in the camera.
Right.
So retinal detachments, the symptoms in initial stages are some flashes of light.
Flashes of light.
Then increase in floaters.
Increase
black,
the floaters.
Black
Yeah,
things
yeah,
moving in front of
like
the eye.
worms.
That the floaters increases, flashes of light. Some curtain is coming in front of the eye.
Curtain is coming.
Or some things we are looking wavy.
Wavy.
The figures are a little bit wavy. These are some symptoms of retinal detachment. And usually, retinal detachment, some people are prone to have retinal detachment who are having high number, minus number,
Minus number.
because they are having long eye and the retina is thin.
We also see, if you see, there are a lot of dots like on the wall or on a paper. So it keeps moving very very quickly. Is it something part of a retinal detachment?
No. It is not a part of retinal detachment. Okay. It's again a part of some floaters. If something movement is there.
If it's rapidly moving back and forth.
So to detect retinal detachment, to have a symptoms, it is very late actually.
Okay.
Again, retina detaches from periphery, then it comes into the center.
Okay.
When it starts into the periphery, there are no symptoms again.
Absolutely.
So regular retina examination is very important, especially people who are having high minus number.
Right.
So we can detect those breaks, those holes in early stage. If we laser those holes or spots, we can prevent retinal detachment. So again, like diabetic retinopathy, glaucoma, this retinal detachment also we can avoid or we can prevent by regular eye examination.
Eye pain, can it be treated as a medical emergency?
Yes, some eye pain.
Yeah, and why do eye pains really happen actually? Is it because you're stressed, you're strained, or?
See, small eye pain we can neglect, like these are due to pricking, irritation. It is related to dryness.
Dryness.
So dryness usually we are on computer. See now people are whole day or more
Screen,
than 12
yes.
hours on the screen mobile.
Yeah.
So that normal person blinks 20 times in a minute, and person who is on screen or mobile blinks only 2 or 3 times in a minute.
Absolutely.
So that leads to evaporation of the tear film.
Oh, it used to be.
And leads to dryness.
Okay.
So in this some mild pain they can face.
They can face that.
But other pain like pain in glaucoma, there is
Glaucoma.
severe pain.
Glaucoma also pain.
Yes, when the pressure rises above 40 millimeter of mercury, 50 millimeter of mercury,
Mercury.
in cases like acute congestive glaucoma, we call, the pressure is very high, and that leads to cruciating pain. Along with that, redness is there, nausea, vomiting.
Nausea and vomiting. Also.
Yes, along with this. So this type of pain is related to glaucoma, and as I said, glaucoma is very dangerous disease.
Absolutely. Absolutely. So common eye-related issues faced by senior citizens. Let's say what, 60, 55, 60. Senior citizens 60 plus.
Common conditions which are faced by senior citizen. I have told about cataract. Cataract is very common. Then other common is age-related macular degeneration. Age-related macular degeneration. So, like we have bone becomes a little porous with age, brittle with age. Our hair becomes white with age.
Yeah.
So our retina becomes degenerate with age.
It ages.
It ages. So that leads to macular degeneration and decrease in visual acuity.
Oh. The visual actually
Visual acuity goes down day by day.
goes down.
So previously there were no treatment, but nowadays some injections are introduced
Okay.
to treat those conditions. And the condition which are not treatable, then we have to give them low visual aids for reading. The low visual aids means some aids or magnifiers or some systems. They will magnify the words or so that they are able to read the newspaper or movies.
Oh, I see.
Now, other conditions with old age is again dryness.
Dryness.
Dryness is there.
Can ultraviolet rays harm your eyes?
Yes,
It can.
definitely. Ultraviolet rays. That's why we advise UV protective glasses.
UV protective glasses.
Especially mountaineering
Yeah. Okay.
people, we advise to use UV protective
UV
glasses.
protective glasses, which is very, very essential. Okay. Okay. Are there any particular foods or nutritional supplements that can help maintain healthy eyesight?
Yes, actually green leafy vegetables,
Green leafy.
citrus fruits.
Citrus fruits.
Then if you are non-vegetarian, then fish.
Fish.
And these are very useful.
What
for
about
eyes.
red meat? Is a lot of intake of red meat going to
Red meat
affect the eye
not,
health?
Suggest as far as eyes are concerned, but fish.
Fish.
Definitely.
Fish is okay. What practical measures can reduce the eye strain if you're exposed to screen time,
Yes.
activities or environments in which, screen time is the first,
Screen time. It is very common problem.
which
nowadays.
includes mobile and
Yes, screen use.
yeah,
Laptop, mobile.
mobiles.
People are on mobile more than 12 hours.
More than
like
12
laptop for more than 12 hours.
Continuously.
So again,
And then they watch TV also.
TV. So normal person blinks 20 times in a minute, as I told. And whenever we are on computer, mobile, that automatically goes down.
Blinking decreases drastically.
That leads to evaporation of tears. And that leads to symptom of dryness.
Oh.
So my recommendation is 20-20-20 formula in that.
20. You look for 20 minutes and look away for 20 seconds.
Yes, see, after every 20 minutes, you have to look 20 feet away.
20 feet away,
and
20
then
seconds.
20
Blinks.
blinks in 20 seconds.
20 blinks in 20 seconds.
So that is 20-20 formula.
20.
So in some way, it will help to reduce the dryness.
This is very important, the 20-20 formula.
I am also following this. I am trying to follow this. Very difficult to remember.
Very, very difficult. 20 minutes on the screen, then remove it and 20 feet away.
20 feet away.
Blink 20 times within a span of 20 seconds.
Yes.
Wow, fantastic. Great. Okay. In which activities or environments is protective eyewear necessary? For example, if somebody is doing that welding work.
Right.
Right.
So the working condition, like where flying objects are there,
Flying
like
objects.
grinding is there, welding is there.
Right.
They should use protective glasses because a lot of people are coming with those small particles which are embedded in the eye. Then they come with red eye. Then we have to remove that particle, treat that for woven wing. So if they use simple thing, protective wears,
Covered completely,
yes,
so that it from no angle.
that will not reach to the eye.
I've also seen, doctor, that if you're staring at someone doing welding, even from a distance, the amount of sparks and which fly, that also kinds of
Yes, that
semi blinds
emits
you.
UV light. No? That damages the corneal epithelium. So if they use that protective
They
device,
use that. They use a big kind
screen.
of a handheld screen with a glass
that blocks the
blocks the
UV
UV.
that goes to the eye. No? So they are not using. Some people they are not using. They are doing welding
I know.
like that
I've
only.
seen that, which is
Yes.
quite shocking. Yes.
And some chemical industries, they
Chemical
should
industries.
use protective glasses.
Yes. Because the
If
fumes,
something
the fumes.
splashes onto the eye,
Yeah.
heat, they
Heat.
should have protective glasses. Heat is coming to the eye. So then mountaineering,
Mountaineering.
UV light from
UV
coming
light.
from peaks of the snow peaks. They can
Yeah, because the snow glare.
we call it snow burn, no?
Snow burn.
To avoid those.
Absolutely.
And then some underwater sports.
Underwater sports.
We should have protective wears.
When people go into swimming pools, it's got chlorine. Can that chlorine also affect your
Yes,
eyes?
it can be irritating. So
Irritating.
special glasses are
Special
there.
glasses should be worn. The swimmers should take care of that. Now, coming to a very important point, insurance. Does insurance cover recommended eye treatments or surgeries?
Yes, actually cataracts are covered.
Cataracts.
And glaucoma and some trauma surgeries are covered in insurance. But cosmetic, lasers and these femto lasers, those are not covered in
Those are
insurance.
not.
Yet it is not covered
Yeah.
because they feel it is under cosmetic.
It's under.
Some insurance companies are covering the number above -7.
Okay.
So my suggestion is while taking insurance, you have to talk to your agents properly.
What all is covered?
Which things are covered, which things are not covered, and you should read the points, policies properly.
The fine print.
Yes, and what is the waiting period? There is a waiting period for some diseases.
Yeah, that will be.
So we should be aware of those things
Yes, because
while taking insurance.
Yeah,
because
because
some companies are providing, some companies are not.
provided. Because often it happens that when you get a medical insurance done, when you go in for your treatment, sometimes you find, oh my God, this is not covered, that is not covered.
At the time of the treatment, we'll come to know.
Yeah, time to
So at the time of taking insurance, these small things, actually insurance agents should clear all
should
these
clearly
points.
tell you, especially in the case wise. Dr. Satav, it was a pleasure talking to you. I would also want you, if you can tell our viewers, is there anything else that, any other message you want to tell our viewers about eye care, vision care, eye health that we probably overlooked in our discussion? Something that
I
all the
think,
viewers should know.
all general information is covered, but most important is, again I am telling, glaucoma and diabetic retinopathy nowadays,
Retinopathy.
because there are no symptoms.
There are no symptoms.
So everyone should go to the clinic and get eyes screened for those diseases, because if they are diagnosed in time, we can prevent
Take
the
remedial
visual loss.
remedy.
100% we can prevent the visual loss.
Visual
Visual
loss.
cases. So we have to listen to our family members. They are telling us frequently, take medicines properly,
I know.
control sugars properly, but we are not. Some people are not listening because there are no complaints in initial stages.
There are no complaints.
And when we lose the vision, and that is very late.
And it's too late then.
Too late. So regular screening of the eye, regular healthy lifestyle, regular exercise,
Regular exercise.
eat nutritious food.
Get eye examinations done.
And once in a year, along with eye, get your blood sugar level tested,
Blood sugar level.
your blood pressure tested.
Blood pressure.
Regular physical examination is also important along with eye examination.
That's very important. Yeah, very good. Dr. Satav, it was a pleasure. It was a very insightful discussion, especially since it concerns the eyes. It was a pleasure to have you over with us and talking to Pune Times Mirror. Thank you so much.
Thank you very much.